myself up at the camera. Are you still recording?
Alright, a study by the Centers for Disease Control and Prevention stated that on average 430,000 cases of infectious disease exposure in the healthcare setting are reported on an annual basis. Of the 430,000 reported cases of exposure in the healthcare setting, 360,000 of these cases involve females. This almost 84% may be contributed to the percentage of women to men in the healthcare field. This is not just limited to people directly associated with patient care, such as nurses, paramedics, and physicians, but this also extends out to environmental service employees who sanitize and clean linen in soiled areas. I have done a lot of researching online through articles as well, but I'm also a paramedic and a statistic as well. Needle stick injuries are the most common injuries and exposures among healthcare providers in the nation. Needle stick injuries can occur during the process of disposal. They can also occur during recapping soiled needles. And the statistics are also very depressing as far as how many healthcare providers are exposed on an annual basis. Now let's learn about needle stick injuries. Alright. According to the Canadian Center for Occupation and Health Safety, about 30% of all needle stick injuries occur during the disposal of a soiled needle. Many healthcare providers are exposed to bloodborne pathogens during the disposal of a contaminated needle are exposed due to carelessness. One way of exposure is during the transport of an open needle without a protective covering. Right here, this is a 20-gauge IV catheter. Once it's inserted through the skin, it's then contaminated with any type of bodily fluid that a patient has. When transporting this open, without a cap over it, or without a safety mechanism, it could easily penetrate the skin. Once the skin is penetrated, the healthcare provider has then been exposed to anything that the patient has come in contact with or currently has as far as diseases or any type of infections. Another way that a healthcare provider can have another needle stick injury or become exposed to anything is disposal of the needle into a full sharps container. This syringe right here with the needle, if I was to walk across the room and attempt to place it into a full sharps container, there may be others just like this sticking out the top. If I was to stick my hand in there, I could easily be pricked with it. That once again exposes me to anything that patient that this needle was used on has been exposed to. And last, someone that's not directly associated with patient care is environmental service employees. If this needle was to be used on a patient and then left in on the bed or anything like that, after the linens are cleaned up, thrown into a linen cabinet, environmental service employees come by, pick up everything, take it down to the sanitation room. When they attempt to clean stuff, they may be throwing sheets, towels, anything into a washing machine. They could easily be pricked by this exposed needle. That again exposes them. They have not been directly exposed to a patient, and they're still at risk for a needle stick injury. Also, the Canadian Center for Occupational Health and Safety also reported another 25 to 30% of needle stick injuries occur when a provider attempts to recap a soiled needle. Now, I know you've probably seen me recap a needle several times sitting here. I've done it the improper way, I've done it the proper way. But the improper way is when a healthcare provider was to use this needle after it is used, come in contact with a patient. They may pull the needle out. You take two hands, you attempt to recap. You could potentially miss the cap, go into your finger. Once you go into the finger, you're also exposed. I myself have done this before. I was lucky enough that I had not made contact with a patient with this needle before. I'd actually drew up some medication, injected into a bag of fluid. Afterwards, I attempted to recap it. I missed the cap and stuck myself in the finger. Like I said, luckily it was not contaminated. Just to give you a few statistics on needle stick injuries. Providers exposed to HIV by bloodborne exposure have 0.3% chance of actual contraction of the disease, while providers exposed to hepatitis by needle stick injury, 30% of the time they will contract the disease. And the percentage of actual disease contraction, it may seem small, with 0.3% and 30%, but when you calculate it to 430,000 annual exposures, I mean, the numbers can get really high really quick. There are several manufactured devices that protect healthcare providers against needle stick injuries. One device is safety needles. You'll see right here, this is an IV catheter, has a safety mechanism. It's just one type. There are several types. Some will have a little white button at the top right here. Once you insert this into the venous system, you thread this catheter out right here. You have a button you can press right here. It automatically retracts the needle back into the device. Once it's retracted into the device, it can no longer be taken back out of the device. This particular one right here has a safety mechanism in the catheter. Once the catheter is inserted and pulled out, it has a locking mechanism over the needle. It cannot be removed, cannot prick you, anything like that. So those are just a couple ways as far as safety mechanism and safety needles that are manufactured and are available for purchase by different services. Another way is recapping. There is an approved procedure, and the approved procedure by the Canadian Center for Occupational Health states that you recap with a needle with the cap on a firm surface. You insert into the cap and then lift up. Take it loosely. Once it's already in there, then you can secure it firmly onto the syringe. Most services just go ahead and say do not recap. I mean, it's a complete 100% no recapping policy. You just dispose of the needle in an appropriate sharps container. Alright, healthcare providers have actually been at risk for disease contraction from needle stick injuries for as long as the practice of medicine has been around. Even though technology in the healthcare setting has improved, the risk of disease contraction to providers has increased over the years with development and discovery of new diseases such as HIV and hepatitis. The Public Health Foundation performed a study in 1999 that stated the number of documented needle stick injuries in the United States now totals above 800,000 needle sticks. Another study performed by the Public Health Foundation also stated that there are over 3.5 million healthcare providers in the world who have a documented needle stick injury over their career. What this tells us is that the future looks gray for healthcare providers if devices aren't utilized and further steps aren't taken to prevent exposure to harmful diseases.